Diabetes Coalition of Palm Beach County Volunteer Training Session. Training objectives. Please become familiar with the mission of the Diabetes Coalition of Palm Beach County, understand the data collection methods of process, and correctly complete an American Diabetes Association risk assessment. Gain enthusiasm about getting residents screened at your assigned sites. The Diabetes Coalition of Palm Beach County began in November 2010. Palm Beach County is fortunate to have an association and group of members in the community that are interested in diabetes. Palm Healthcare Foundation is one of our greatest supporters. Please review our leadership team and familiarize yourself with who they might be. Data collection process takes place usually from November 8th to November 14th each year during Diabetes Month. We normally coordinate 50 assessment sites throughout Palm Beach County. Volunteers complete the ADA risk assessment tool via a one-on-one interview with residents. Arrangements will be made to make sure that you have all the necessary documents, forms, and giveaway bags, and they will be delivered to your site prior to the scheduled screening date. Please complete the screening paperwork and return it back to the Diabetes Coalition. The integrity of the data is real important to us. Data integrity refers to maintaining and ensuring the accuracy and consistency of the data over its entire life cycle. And it is a critical aspect to the design, implementation, and usage of any system which stores and processes and retrieves data. There are 3 separate forms and 3 separate languages available for the Type 2 diabetes risk assessment: English, Spanish, and Creole. Complete the ADA risk assessment. It is easy and self-explanatory, but there is a little bit of information that may be helpful to you. The numbering system is either 1, 2, or 3. It is not the person's age, it is not the person's weight that is entered in the respective boxes. Once you enter the number 1, 2, 3, you will tally it at the bottom. Once you tally it, please reverse the page. There are additional questions on the back that are real important to us. These research questions on the back provide us with demographic information and geographical information about diabetes in our county. Once you have finished, please give the participant a Know Your Numbers card. This card, write the number that they had as a score. If you're doing glucose screening numbers, please put their glucose number also. This card will give them the opportunity to take this card to their primary care physician and advise them that they did have a high score and ask the doctor to evaluate them further. If the score is 5 or more, it indicates they are at risk for type 2 diabetes. Encourage participants to contact their primary care physician, exercise, and eat healthy. If the person does not have a primary care physician, please give them the 211 guide that provides them with information about the free clinics in our community and the federally qualified health centers where they can reach and access medical care. Importance of the screening residents at your site. In 2014, the Diabetes Coalition screened 2,578 participants and found 1,136 to be at risk of type 2 diabetes. Many people are at risk for diabetes and don't know it. There are no symptoms to pre-diabetes. Diabetes is a huge health epidemic that is preventable. Be friendly, get residents to approach your table. It only takes 3 minutes. Explain the benefits of getting screened. After the event, please make sure that you return all the diabetes risk assessment forms to the Diabetes Coalition. Data will be collected in SurveyMonkey and analyzed. The results will be tallied and put into a PowerPoint presentation on our website and provided to many different organizations. We thank you for being a member and a volunteer in our diabetes screening of 2015.